My name is Amal and I am an iFuse patient. I had problems with my back. My back was hindering me from being active and going places. And my husband really, he encouraged me. He said, you should see a back doctor. I went to a few doctors to find out what's going on with my back, why I have this pain. But I was not comfortable with them. I got referred to Dr. Monsivais. Right away I could tell he has a solution to my problem.
Hi, I'm Daniel Monsivais. I'm a neurosurgeon here in San Antonio, and I practice at Christa Santa Rosa, Westover Hills with Texas NeuroSpine. Today we're going to talk about SI joint pain and how the SI joint functions in our bodies. The SI joint stands for sacroiliac, and it's where the iliac bones meets the sacrum, which is the bottom part of the spine. It absorbs a significant amount of our daily forces. About 15 to 30% of chronic low back pain has a component of SI joint pain. Things that will make me suspect SI joint pain is the pain generator. Patients often have excruciating low back pain. They can often pinpoint their pain in their low back. They'll point over the SI joint region, which we call a Fortin finger. It affects everything they do, from sitting too long, riding in the car, sometimes extended periods of standing, bending over and lifting things, rolling over in bed can aggravate their pain. It's very high impact on their quality of life.
I was picking up stuff in the garage and I dropped something from my hand and I bent over to pick it up. And when I stood up, the pain was literally unbearable.
When I suspect it's the SI joint versus the hip joint or the lumbar spine, I will perform a physical exam, which includes provocative maneuvers, and then I will also review their MRI scan, make sure there's no other pathology that can explain their symptoms. Then the next step will be SI joint injections, and that helps confirm the diagnosis. Once we have a diagnosis of SI joint dysfunction, we start with conservative measures. When conservative measures fail, I recommend a minimally invasive SI joint fusion, which is an outpatient procedure. It takes less than an hour and patients go home the same day. Now we come through the side of the muscle into the iliac bone and through the SI joint into the sacrum. I know there's a big misconception with fusion. Many people hear the word and think they're going to lose range of motion or mobility, but in reality the SI joint is not supposed to move very much. And so when we stabilize it, they actually improve their mobility. By 3 months out, patients have no restrictions and they can get back to their life and do whatever they want to do.
After my recovery, I do all the things that I like to do. We're a family of 5, my husband and I, my sister and her 2 daughters, and I'm constantly moving during the day and I get to do all of that and I can't be more thankful.